Angels Care Home Health, serving Hayes and the surrounding areas, is a Medicare-certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
I would recommend Angel Care to anybody. They have really helped me regain my strength.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible. Angels Care Home Health. We serve patients.
I couldn't have survived this without Angels Care.
Eagle Community Television presents Community Connection with your host, Mike Cooper.
Hello and welcome again to Community Connection from Eagle Community Television. Thanks for watching, and thanks as always to our producer, Jeff Durall. We're in the Cody Conference Room at the High Plains Mental Health Center in Hayes. Joining us is manager of the Community Education Outreach Program at High Plains, Ken Loos. Ken, October has many mental health awareness areas that it talks about and covers and hopefully gets information out on.
Yeah, it really does. We've got Mental Health Awareness Week, the first full week in October. There's also an awareness period of time, again, I believe a week, for obsessive compulsive disorder. And the entire month is designated Substance Use Prevention Month, you know, for those individuals that may struggle with alcohol, marijuana, other drugs. You know, the idea that for some individuals, Mike, you know, it's a way for them to self-medicate when they're struggling with a mental health disorder. That would add to it, and so it's a good time to get information out there and just to make people aware in general.
You might mention, too, that Ken has a monthly visit on the Eagle Communications Morning Show with Boomer and Mike. Be sure and join Ken when he is a visitor on a monthly basis on the Morning Show with Boomer and Mike. Also been a part of the House to Home program with Fort Hays State Assistant Professor Chris Munch. So be sure and catch those on Eagle Community Television as well. So a busy guy here. Appreciate you taking the time to join us, Ken. And now to the topic of the recent mass shooting in Oregon and the ones that have preceded that, which have seemed to occur almost every couple of weeks. Can you help us to understand anything about these mass shooting events that will help us to bring some kind of rational thinking to it or response to it, Ken?
Yeah, what a sad, complicated, tragic situation. For whatever reason, the United States seems to have more of these shootings, these mass shootings, than any other Western country. You know, a couple of things, Mike, that we worry about, quite honestly, in the mental health field. One is that we have to always keep in mind that most individuals who suffer from mental health challenges are more likely to be the victims of crime, not perpetrators. Most people are not going to be a danger to anyone else. Suicide is a real risk in mental health issues, and when we look at gun deaths throughout the United States annually, over 60% involve suicides. And so that is a real factor. But a lot of experts, a lot of researchers have pointed out that if we could cure all mental health disorder just like that, just right as we're speaking, everybody is taken care of, at most you would reduce the violence in this country by about 5%, at most. So I mean, those factors need to be repeated, because I think right now, adding to what's inherently a tough stigma with mental health is this sense that instead of being a medical designation, instead of saying depression or anxiety or bipolar or schizophrenia or a whole host of mental health challenges, instead of looking at it as a medical descriptor, it's becoming almost a reason for all violence, and that's just not true. And we have to stay focused with that. Individuals that tend to do these mass shootings, they're, again, researchers and experts tell us, Mike, there are three basic things that go on. One is that there's a real sense of narcissism. They are very into themselves. They think of themselves as special. Maybe they think about themselves as basic rules, laws don't apply to them. They have a very, very strong grievance against someone or an institution. You know, a lot of us, we're working hard, we're stressed, we've got family stuff going on. This is above board. This grievance is just, you know, like a normal grievance on steroids. It's just a real overarching, eating away at them. And then there's that sense of wanting some infamy. Their life, for whatever reason, they feel is helpless, hopeless. It's not working out as they wanted to. They would like to go out in a sense of doing something outrageous, something horrible. So again, there's so many things to look at, and one of the things I guess to really focus on with your viewers and with people in our 20 counties, when someone is struggling, if they're not able to ask for help, to go to professionals, go to their family doc, go to their nurse practitioner, the county health department, come to High Plains, talk to someone in the faith community, if they're not able to take that step themselves, that loved ones or others should try to help them take that step, to reach out for help. And that is, frankly, again, one of the things we worry about. If we keep scapegoating everything to mental illness, if we blame everything on mental illness, you are adding to the stigma, and you're making it more likely that people won't reach out for help, because they don't want to be labeled dangerous. They don't want to be labeled, a threat, when in reality they're struggling with something very personal. Their marriage maybe is hitting some rocky spots. They're struggling at work. We really want to be cautious about that.
You have an interesting article that you brought with us from one of the New York Times writers, A New Way to Tackle Gun Deaths. Give us some highlights of that. And this is insightful information, Ken.
It really is insightful information, and I've always thought Nicholas Kristof at the New York Times is a very fair, balanced reporter. He's not alone in this, but the idea is to really start to look at gun deaths in this country as a public health matter, kind of like the way we look at car accidents. We don't just say, well, we all drive, however many deaths are going to happen, that's just the way it is. We have seat belts, we have airbags, we have padded dashboards, we have safety devices of all kinds. We didn't ban cars, we made them safer. Things like swimming pools. If you have your own swimming pool, how to protect or prevent accidental drownings of children. So really arguing that it's time to look at gun safety that same way. It's so political right now, Mike, that it's hard to even just have a conversation about common sense gun safety, because immediately people may get defensive, may start to say, oh, you want to ban all guns. It makes it really, really tough to have a conversation. And yet, according to this Kristof article, we have average of 92 deaths in the United States every day due to guns. And since 1970, this is actually beyond belief, more Americans have died from guns than died in all U.S. wars going back to the American Revolution. That is since 1970.
Wow.
We're talking about approximately 1.4 million war deaths since 1775 versus 1.45 million gun deaths since 1970, which includes suicide, murders, and accidents. And another interesting point he brings out, in America, this is a quote, more preschoolers are shot dead each year, 82 in 2013, than police officers are in the line of duty, 27 in 2013.
More children,
preschoolers are shot dead each year than police officers in the line of duty.
And yet this information is so easily dismissed by people who could make some differences by saying, oh, you want to ban all guns.
Exactly right. And one of the things we talk about when it comes to suicide prevention, I mentioned, over 60% of gun deaths in the United States are suicides. It doesn't happen to every individual that suffers from a mental health crisis that they think about suicide or contemplate it, but it's a common thought. It's a common part for individuals who feel like, life is not worth living. When we talk about guns, we don't talk about banning, getting rid of them. We would have no audience in Northwest Kansas. We would have people just immediately saying, what you have to say is not credible. But we talk about having gun lockers and making sure that they're safe in the home, separating weapons from the ammunition, using trigger locks, temporarily disabling a weapon, removing a firing pin, for example, if someone in your household or someone that you care about is struggling with mental health issues, just to make it a little bit safer, just to make it to make those impulsive thoughts that usually occur for someone when they think about ending their life, to make it safer in that impulsive moment that they don't reach out and do something that cannot be fixed, that cannot be taken care of.
Yeah, because a gun is permanent. I mean, it's final. It's generally going to result in the death of the individual.
Correct. You know, one of the things we still see in the United States is that women who are contemplating suicide, more often they will rely on overdoses or they'll cut themselves in an attempt to bleed out. But that opportunity then to reach out for help, you know, that ambiguity, that real sense of I don't want to die, I don't want a permanent solution to a temporary problem, they're able to call for help. They're able to get to the hospital. When you're dealing with guns, that ambiguity doesn't have a chance to kick in.
And that also plays a big part in the domestic violence situations as well, where a gun can be a final solution to a sudden impulse.
Yes, a very sudden impulse. You know, this seems incredible, I know, but when they talk about that suicidal crisis, where someone is really in that state of mind where it's, I've got to do something, I cannot go on with the way things are, that crisis lasts on average 5 minutes or less. And that's why we talk about it so impulsive, or so important to really help individuals when they're in that impulsive crisis, to protect them a little bit more, to make it a little bit harder.
Ken, you touched on this earlier, and I'd like for you to come back to it, the role of mental health facilities in combating these instances. Because again, intervention can change lives.
Absolutely, in a positive way. We saw last calendar year almost 5,470 clients throughout our 20 counties. We take surveys, we follow up with folks, so we see that our services are helpful and beneficial. You know, we really need to look at mental health the same way we do as diabetes, or the same way we do as asthma or high blood pressure. There are very effective treatments available. If a person has health insurance, of course mental health, we utilize those health insurances, but if they don't have insurance or they're underinsured, we have a sliding fee scale as well. Because probably second to stigma, Mike, or maybe even for some people more important than stigma, is the fear of cost. I can't afford this. But you know, reach out for help, find out your options that are there, and catching problems as quickly as possible. Again, just like we would with diabetes and asthma and high blood pressure, the faster we catch depression or anxiety or attention deficit disorder or anything, the sooner we can improve someone's life.
And the Kansas legislature could do a big part in funding the assets of High Plains Mental Health Center.
You know, that's absolutely true. We are a quasi-governmental agency. We're technically owned by the 20 counties of Northwest Kansas, but as state funding has gone down over the past 7+ years, you know, it puts more pressure on our counties, and our counties, with oil prices and other challenges that each county has, cannot pick up that slack, and so that's inherently a problem. When you look at individuals willing to come to Northwest Kansas and work for a place like High Plains, it's not as many people as are probably wanting to move to Kansas City or Denver, and it's a challenge not to burn out good folks who, you know, really care about what they're doing, but there's a lot to do, and a lot of individuals.
It's like having more kids in the classroom. You've got staff that's responsible for more input and more stresses on staff at the same time.
Yes, it's a great comparison. You can have the most dedicated people on earth, people who really care about what they do. They get up every day wanting to do the best job they can, but they can be overwhelmed by numbers. They can be overwhelmed by the degree of challenges within, whether it's a classroom or in a mental health setting or in a community.
So once again, help is available. Treat it as you would a disease, an illness, a physical disability. Seek help.
Seek help. Get information. You know, check online. High Plains, we have a website, we have a Facebook page. There's a lot of great resources out there. The National Alliance of Mental Illness, NAMI, and AMI, National Institute of Health, you know, American Psychological Association. Bottom line is, don't be afraid to ask for help or to at least get some information. Don't wait until a crisis occurs.
Ken Loos, Manager of Community Education Outreach at High Plains Mental Health Center. and our community connection.
Angels Care Home Health, serving Hayes and the surrounding areas, is a Medicare-certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
There's not any words to describe their kindness.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible. Angels Care Home Health. We serve patients.
They saved my life.